Hello. Today's topic is actually by demand. One of our callers called in and wanted to talk about thyroid illness and specifically Hashimoto's thyroiditis. So I first thought I would explain what the thyroid is. It is a gland that lives approximately here, and it is shaped like a bow tie so that we have two lobes, and the center part is called an isthmus. The thyroid secretes two hormones, T4, which is thyroxine, and T3, which is triiodothyronine. Now, there's approximately an 80-20% ratio such that it makes about 80% T4, 20% T3, but T3 is the more active form of the thyroid hormones. So we have an interplay between all of the hormones in the body as a large network of neurochemicals that are chemical messengers for each other, talking to each other. And the thyroid gland has been proposed to be the conductor of the whole symphony of hormones. So it is potentially considered the mother hormone. And there's an interplay between the hypothalamus in the brain, talking to the pituitary in the brain, and that pituitary will actually talk to the thyroid gland to secrete the hormones based upon the demands that the body needs. So with the thyroid being in charge of the whole symphony of hormones, it being the conductor, it will be in charge of base metabolism. It will be in charge of hormone regulation, heat regulation, speed of the heart, sexual hormones, including menstruation in us women, and to a degree, some mood-related issues, because those thyroid hormones are circulating throughout the body, and every cell in the body has receptors to take in the thyroid hormone. So what are some of the symptoms if your thyroid hormone levels are low? Well, a lot of us will know this pretty commonly. We may feel sluggish, obviously tired. We may have a cold intolerance. Some people will notice that their hair and nails will change characteristics and typically be getting brittle or thin. We might start noticing some weight gain. We might start noticing some depressive features. And if left unattended for a prolonged period of time, we may notice that the heart rate is slow, that our lipid metabolism is off, and our sugar metabolism is off. So that we would call hypothyroidism. Symptoms of hyperthyroidism, in which the thyroid gland is overstimulated, would be a sensation of jitteriness, anxiety, agitation, the heart rate being very speeded up, heat intolerance, insomnia, weight loss, and bone loss. So there are a lot of thyroid-related troubles based upon their causes. So sometimes the thyroid gland could just simply poop out. Sometimes it has cancerous nodules and therefore it needs to be removed. But the one specific thyroid disease I'd like to focus on per request is Hashimoto's thyroiditis. So thyroiditis implies that the thyroid gland is inflamed. So in Hashimoto's thyroiditis, the body has secreted, either by the T cells or the B cells in our immune system, it has secreted antibodies that attack the thyroid gland. So we might measure them as far as anti-thyroid receptors, antibodies, anti-thyroid peroxidase, and several others. And if those are positive, that would be indicative that we now have an autoimmune process attacking the thyroid. Hashimoto's thyroiditis implies that the thyroid gland is now rendered slowed down or hypothyroid. And we won't get into a whole lot of the differences today, but if that autoimmune phenomenon has speeded up the thyroid gland, we call that Graves' disease. There is a large interplay between our immune system and the thyroid, such that vitamin D3 is an immune regulator that can help keep those antibodies at bay to try to keep our thyroid gland healthy. So, for instance, if I'm measuring any thyroid functioning, which I will measure TSH, T3, T4, the antibodies, sometimes reverse T3. I will also measure vitamin D3 because many times we will find that that D3 level is low, which renders it less capable to help regulate any of the immune function for that thyroid gland. So the treatment of this, it's very hard, for instance, to just go in and get rid of the antibodies, but we would like to optimize the vitamin D3 as a regulator. And we may actually have to supplement with prescription T3 or T4. And I will just give a quick disclaimer about thyroid extract and Armour thyroid and Nature thyroid being a much more natural compound because we are extracting it from glands of animals. But I also will warn the autoimmune Hashimoto's patient that if that patient is already apt to be making antibodies against the human tissue, it is apt to make antibodies against the thyroid pork, for instance, and the animal protein portion of those medications. So sometimes it is best to remain synthetic bioidentical to help treat the thyroid gland if we have Hashimoto's thyroiditis. I also tell people, since I have an integrative approach, that we need to optimize what I call the plant food for the thyroid gland. So this is iodine. Iodine is needed for that thyroid survival, as well as a very good product of B-complex vitamins to help create the cellular energy for that gland and those nodules to function. To that note, I will have patients be very cautious of heavy metals, and we may wind up talking about heavy metals because, for instance, mercury, lead, arsenic, those heavy metals may actually displace the iodine from the thyroid gland, which will then render it incapable of taking up the iodine for its proper functioning. And iodine obviously is within the molecule of T3 and T4, and it is actually the only gland in the body that needs iodine for its survival. So I will also tell people that it is wise to have some iodine in your salt versus some of the latest cooking trends, which are trying to remove the iodine from the salt and remain in sea salt, black salt, Himalayan salt. And we want to make sure that we can infuse at least enough iodine for the proper plant food for the thyroid gland to optimize, for the thyroid gland to be operating optimally. So I always will go into the epigenetics of potentially what may which may have rendered us in an autoimmune phenomenon or an autoimmune capacity, and or what are those things that we could do epigenetically to optimize our thyroid functioning. So we as a society have gotten very hygienic, and with the uber hygienics that we have had, our immune system has laid a lot more idle than it used to in the past, because our immune system used to fight bacteria, protozoan, and things in our water sources, things in our soils that we have rendered somewhat sterile today, and this can make us a much more apt for an autoimmune phenomenon. I will also say that we need to be very mindful of radiation. And I will warn patients that, for instance, if they're going to the dentist and getting dental x-rays, some of those x-ray beams and its radiation will radiate and spray down to the thyroid level, such that I always recommend to request a thyroid shield to slow down or protect from those radiation exposures and radiation rays. It's also postulated that potentially we have a low selenium diet from some of the practices in our soils and our vegetation not bringing in as much selenium. So we may want to supplement with some selenium in addition to the iodine and the B complex vitamins. Again, back to the vitamin D3 concept. We want to have a little bit of sun, but D3 comes from sun exposure, which has D1, goes to the liver to become D2, goes to the kidney to become D3. So sometimes it's just as easy to supplement with the D3 to help with thyroid functioning. It is postulated that, again, with an immune phenomenon, potentially we had an infectious cause and hepatitis C, and the herpes virus has been postulated as potentially being a trigger. There are actually anti-cancer medications and anti-MS medications that will render the thyroid less active. We also have oil refineries and petrochemical complexes that have rendered our human bodies much more autoimmune. And to that note, we would like to avoid the herbicides, pesticides, and specifically paraquat and manab are two of the postulated toxic herbicides and pesticides that may attack the thyroid gland and or render us autoimmune. We have to be careful of the polychlorinated biphenyls, which are the PCBs, and the bisphenol A, or the BPAs, in our plastics. So, to summarize, there is a way to optimize a better diet, to avoid chemicals and pesticides, to avoid radiation, to get a little bit of sun, to optimize our supplementation, to help potentially prevent the autoimmune phenomenon. But certainly these are some postulates. We suspect there may be a lot more interplay with the autoimmune phenomenon and Hashimoto's thyroiditis rendering the thyroid inactive. I will certainly entertain any questions if you would like to post those below. Make sure that you subscribe to my channel so we can have a lot more discussions on health topics that are of concern to you. As a reminder, this one came from a viewer, so I appreciate any and all input. And until we meet again, be well.